Measles. The word alone might sound like something from the history books, a disease we conquered ages ago. Think again. Measles is back, and it's angrier than ever. This highly contagious virus is sweeping through communities worldwide, and if you think it's just a rash, you're in for a rude awakening. The symptoms of measles aren't just uncomfortable. They can be downright deadly if ignored. Buckle up because this is everything you need to know about measles symptoms. The calm before the storm. Early warning signs. Measles doesn't start with a dramatic rash you've probably seen in photos. Oh no, it's sneakier than that. The early symptoms mimic the common cold, making it easy to dismiss. You'll feel tired, have a runny nose, and develop a mild fever. No big deal, right? Wrong. Measles spreads before you even realize you have it. You're contagious up to 4 days before the rash appears, and by then, you've likely already spread it to anyone unlucky enough to share your space. Fun fact, measles is so contagious that if one person has it, 90% of unvaccinated people around them will get infected. Yes, you read that right. The fever that won't quit. One of the hallmark symptoms of measles is a high fever. We're talking temps that can soar up to 104 degrees Fahrenheit, 40 degrees Celsius. This isn't your average I feel warm situation. It's a full-blown, body-wrecking fever that leaves you weak and drained. But here's the kicker. The fever doesn't just happen once. It comes in waves, climbing higher as the infection progresses. If you're sweating it out and your thermometer keeps climbing, it's time to take this seriously. The eyes have it. Watch out for conjunctivitis. Think pink eye is annoying? Measles takes it to the next level. One of the key symptoms is conjunctivitis, aka red watery eyes. Your eyes will feel irritated, sensitive to light, and downright miserable. But it's not just a cosmetic issue. This is a red flag that the virus is in full swing. Pro tip, if you find yourself squinting in a dark room because the light feels like a personal attack, it's time to get checked out. Koplik spots, the measles sneak attack. Here's a symptom you probably haven't heard of. Koplik spots. These tiny white or bluish spots show up inside your mouth, usually on the inner cheeks. Think of them as measles calling card, a telltale sign that the virus is in overdrive. Why does this matter? Because Koplik spots appear before the rash. Spot them early, and you might just get ahead of the disease. Ignore them, and you're headed straight for the storm. Ah, the infamous measles rash. This is the symptom that gets all the attention, and for good reason. The rash usually starts on the face, around the hairline, and quickly spreads downward to cover the entire body. We're talking red, blotchy patches that seem to take over your skin. If you think measles is just about a fever and a rash, think again. This virus has a dark side, and the symptoms can escalate into life-threatening complications. Here's what you need to watch for. Pneumonia. Measles can weaken your immune system, leaving you vulnerable to secondary infections like pneumonia. This is the leading cause of death in measles cases. Encephalitis. In rare cases, measles can cause brain inflammation, leading to seizures, confusion, or even permanent brain damage. Yes, it's as terrifying as it sounds. Dehydration. With the fever, rash, and other symptoms, dehydration can set in fast, especially in young children. SSPE, subacute sclerosing panencephalitis. This is the long-term nightmare. SSPE is a fatal brain disorder that can develop years after measles infection. The vaccine, your best defense. The MMR vaccine is a monoshunrin game changer. It's 97% effective at preventing measles and has saved millions of lives since its introduction. If you're vaccinated, you're not just protecting yourself, you're helping to stop the virus in its tracks. But here's the shocking stat. In 2023, measles cases surged by 58% globally due to vaccine hesitancy. Current treatments, what to do if you get measles. So what happens if you or someone you know contracts measles? Unfortunately, there's no specific cure for the disease itself. Treatment focuses on alleviating symptoms and preventing complications. Here's what you can do. Stay hydrated. It's crucial to drink plenty of fluids to avoid dehydration, especially if you have a high fever. Rest up. Your body needs energy to fight the infection. Make sure to get plenty of rest. Fever management. Over-the-counter medications like acetaminophen can help reduce fever and relieve discomfort. Always consult a healthcare provider before giving medication to children. Vitamin A. There's growing evidence that vitamin A supplements can help reduce the severity of measles and prevent complications, particularly in children. Seek medical care. If symptoms escalate, especially if you experience difficulty breathing, persistent high fever, or extreme lethargy, seek medical attention immediately. Isolation. Since measles is highly contagious, it's important to stay away from others to prevent the spread, especially vulnerable populations like infants or people with weakened immune systems. Subscribe and watch this video next.